Thank you. Good afternoon, Chair, and all of you. I would like to thank the Chair and her staff for working so diligently with my office on drafting the committee amendments. I am pleased to accept the committee amendments on Assembly Bill 1356. Under existing law, when there is a death of a resident within a drug and alcohol recovery program at a licensed facility, the California Department of Health Care Services is required to investigate and write a report on the incident. As part of the investigation, the facility where the death occurred is required to provide DHCS with a description of the events and incident, including the time, location, and nature of the event or incident. The facility is also required to provide DHCS with a list of the immediate actions that were taken, including persons contacted, and a description of the follow-up action that is planned, including but not limited to steps taken to prevent a future death. Despite the requirement for such facilities to provide the department with information in the immediate aftermath of a death of a resident within the facility, there is no statutory requirement for these facilities to provide any subsequent reports in the aftermath of the incident. AB 1356 will require a facility which offers a drug and alcohol program to do two things. First, to submit within 60 days of the initial incident any relevant information that was not known at the time of the initial incident or was not known but was not provided to the department in the initial report. Second, if any deficiencies are identified in a facility's response to the death of a resident, the facility will be required to submit a report detailing any follow-up actions that were implemented in response to the DHCS communications. AB 1356 is a common sense solution to strengthen DHCS's death investigation policy, provide the department with the necessary information to properly regulate and oversee facilities which offer drug and alcohol programs, and improve the safety of those residents within the facilities who are receiving treatment. I have with me Breana Zweben, who will be speaking in support of AB 1356.
Thank you. You'll have 2 minutes.
2 minutes.
My name is Breana Zweben, lead investigator at Jared's Law. Today I speak not just as an investigator, but as someone who lost their beloved partner to a preventable tragedy. John McLister walked into Asana Recovery on April 3rd, 2021, a hero, with hope in his heart, seeking a chance at a new life, and fighting for his future. Instead, he became another victim of a system that prioritizes profit over human life. The evidence is both clear and devastating. Medical records and toxicology results confirm required medications were never administered. Critical surveillance footage contained unexplained gaps during vital moments. Emergency medical response was intentionally delayed, as documented. Expert testimony from Dr. Mario San Bartolome confirms John's death was entirely preventable. AB 1356 would strengthen our current death investigation policy in 3 crucial ways: maintaining the crucial 24-hour telephonic report requirement, ensuring immediate notification of deaths, preserving the 7-day written report mandate that details the initial investigation findings, most importantly, adding a new 60-day comprehensive follow-up report requirement that would document the actual implementation of promised corrective actions, reveal new information discovered during extended investigation, and ensure disclosure of any details known but not initially reported. Had this law been in place, Asana Recovery would have been required to detail their complete action plan to prevent future deaths, document the implementation of that plan, and disclose all information about John's death, including details that emerged in subsequent investigations. Since John's death, our investigations have revealed a pattern of negligence at Asana Recovery, with multiple victims coming forward. Each story echoes the same systemic failures that took John's life. The 60-day reporting requirement would create a crucial window of accountability, preventing facilities from making empty promises of reform that are never implemented. John's intake paperwork stated his simple goal: get through withdrawals safely. The facility failed this basic promise. Today, his children are forced to grow up without their father, a devastating consequence of inadequate oversight. I urge you to pass AB 1356, not just for John, but for every victim whose story I've uncovered, and tragically for those whose stories we may never know. Thank you.
Thank you.